Okay, this discussion is going to center around the principles of ultrasound and diathermy. So first, again, we're going to look at just the kind of the principles behind the modalities, kind of talk about why they help, and then we'll get into the clinical application and some of the things associated with that. So start out first by looking at ultrasound. So ultrasound utilizes sound energy in the rehabilitation process. So it uses acoustic waves between 800 kilohertz and 3 megahertz. And this is basically created with the mechanical vibration of a crystal kind of housed within the ultrasound head. So when you look at your ultrasound unit, there's essentially a crystal in there that creates this energy once electricity is kind of conducted through there. And it's going to be applied using a conducting medium. The two most common conducting mediums are ultrasound gel and gel pads. They tend to be the most effective. There are some other conducting mediums that do get utilized, and we'll talk about some of the benefits and drawbacks of them. Now, probably what a lot of people, or maybe even what your thoughts are on ultrasound, is that it's commonly used for diagnostic imaging, and essentially you're utilizing the same type of energy. It's the same type of energy. The biggest difference is therapeutic ultrasound utilizes higher intensities. So kind of the power behind therapeutic ultrasound is much higher than what you would have with diagnostic. And again, that's to create the cellular and mechanical effects that you're going to get with the ultrasound. So in talking about an ultrasound crystal, there's some really important things to kind of look at. Particularly, this kind of goes into when you're acquiring, looking to purchase an ultrasound crystal, because there's those of different qualities. You want to look at the effective radiating area. So the effective radiating area is an area that is going to get at least 5% of the peak sound energy. So if you look at this illustration right here, you see this ultrasound head, the majority of it is going to receive at least 5% of that peak sound energy, meaning that you're getting some really good energy coming through the sound head. And it usually is a little bit smaller. So when you look at an ultrasound head, it's usually not the entire surface area of the sound head that's going to be conducting the ultrasound energy. It's usually an area that's just slightly smaller. And what you have over here is an ultrasound head that is not very effective and does not have a very good effective radiating area. So that's one point of the ultrasound crystal. Another one is what's known as the beam non-uniformity ratio, and that's what you're looking at over here. So what the beam non-uniformity ratio is, it's the ratio between the average intensity and the peak intensity, okay? So you basically take the spatial peak intensity, put that over the spatial average intensity. What this basically does is the lower the BNR, the less risk you have of developing what are called hotspots. So when you look at these two ultrasound heads, here you're seeing an ultrasound head that has a very low BNR. Okay, so what that means is the ultrasound energy stays pretty uniform. I mean, it's never going to be perfect, but you get a pretty uniform application of ultrasound. What you're seeing over here is one with a high BNR. Okay, and what you notice is there's this little spike, and basically what that tells you is that the peak intensity is a little bit higher beyond what the average intensity is. And so this one would have a higher BNR. The only issue with this, now it's not necessarily inherently dangerous to use, but you have a much greater chance of developing what's called a hotspot. And with ultrasound, when a patient gets a hotspot, it basically just makes the treatment uncomfortable. Okay, it can cause tissue damage. Typically, the patient's not going to make you stop the treatment before tissue damage happens because it's going to hurt. So acceptable BNR is usually between 2 and 6. Obviously, as you're getting closer to 6, you're going to have something that looks more like this, and it's going to just be difficult to deliver your ultrasound treatment. So ultrasound parameters. So this is kind of like the key point when you're actually utilizing ultrasound. So whenever you're coming up with an ultrasound treatment, you're going to be essentially setting 4 different parameters, and it's all going to be based upon what your goals are, where the tissue is located, and what it is you're trying to accomplish. So you have the intensity, which is essentially the dosage of the ultrasound. So that's the energy in the crystal area. So this is usually displayed as watts per centimeter squared. So when you'd be documenting your intensity, you'd be documenting it as watts per centimeter squared. Your frequency is what is dictated by the depth. So the depth of the tissue that you're trying to reach. If you're trying to reach something more superficial, you're going to use a 3 megahertz. If you're going to treat something deeper, you're going to use 1 megahertz. So 3 megahertz goes up to about 2.5 centimeters. 1 megahertz goes deeper than that and goes upwards to 5 centimeters. So again, frequency is based upon the depth of the target tissue you're trying to reach. Duty cycle, you look at whether you're essentially doing a thermal or non-thermal treatment. So if you want to get a significant increase in tissue temperature for the goals you're trying to achieve, you would use continuous. If you are not looking to get a significant temperature increase and you're trying to use ultrasound strictly for the mechanical effects, you will select a pulse treatment. And then your time, you'll be looking at based upon, again, what your goals are, particularly when you're looking at thermal treatments. We'll talk about time related to pulse treatments. Where time gets to be quite variable is when you're looking at thermal treatments. And the reason for that is your time is going to be based upon how much of a tissue temperature increase you're trying to get. And we'll kind of go through the procedure for how you select that as you're going through the ultrasound parameters. So again, when you're looking, this kind of looks at duty cycle. So when you're looking to determine, when you're going to do an ultrasound treatment, one of the things you're going to determine is, are you trying to get a 1 degree increase or more in the tissue temperature, or are you looking to not get a significant thermal effect? Again, you say non-thermal, technically there will always be some type of thermal effect, but basically you're keeping it below. If you're keeping your thermal increase below 1 degree, it's not significant. It's not going to impact what goes on with the tissue. Everything 1 degree Celsius and above will. So all this is demonstrating the difference. So when you're talking continuous, the ultrasound energy is basically on the entire time. So as you're delivering the ultrasound, you get this continuous pulse that's happening, and what will happen is over time, the energy will build up and you'll get a temperature increase. So based upon your frequency, your intensity, and your time, you'll get a certain degree of temperature increase above baseline. Over here, you're looking at a pulse treatment. Okay, so what a pulse treatment does is it has an on and off time. So usually most machines will let you pick between a 10% pulse, 25% pulse, and a 50% pulsed. All that tells you is, so for instance, if you're doing 50% pulsed ultrasound, what that's telling you is for 50% of the time of your treatment, the ultrasound energy will be on. The other 50% it will be off. Okay, and again, you will use that type of ultrasound if you're not looking to get a thermal increase. Okay, so, and we'll, again, clinical application wise, we'll talk about why you might want to do that. If you're looking to get a thermal increase, you're going to use continuous because that's where you're going to get your significant energy increase in a much more efficient manner. Okay, so thermal ultrasound parameters. Okay, and this is what I was talking about. So it's dose time dependent. It depends on your treatment goals. So you're essentially looking to do one of 3 things with your thermal ultrasound. You're looking to increase it by 1 degree, by 2 to 3 degrees, or 4 degrees Celsius. And what you're doing is you're taking that above baseline. Okay, so what you're looking to do is with that. So a 1 degree increase is used in the subacute phases if you're just looking to increase metabolic activity. So you're just trying to essentially in the subacute phase, because obviously in the acute phase you don't want a temperature increase because of what's going on during the acute inflammatory events, but subacutely you could increase the metabolic activity and try to enhance healing. A 2 to 3 degree increase reduces chronic pain and spasm and increases blood flow. And a 4 degree increase is used to increase the viscoelasticity of the tissue, so basically allow you to stretch and mobilize the tissue. Now, obviously, these goals carry over. So for instance, at 4 degrees, so 4 degrees is probably one of the more common things you're going to do because a lot of times you're looking to stretch and mobilize tissue. Essentially, what you will still get the benefits of the other temperature levels. In other words, you're still going to increase metabolic activity, obviously, because you're still raising the temperature, and you're obviously still going to reduce chronic pain and spasm because you're actually exceeding that 2 to 3 increase. Okay, so they're not mutually exclusive. As the temperature goes up, you're still getting the effects of the lower temperatures. Treatment area and application. So you only want to treat an area 2 to 3 times the effective radiating area of the sound head. Now, an easier way to kind of quantify that if you are treating them, so instead of trying to think about the effective radiating area, look at the size of the sound head. You should never treat an area more than 2 times the size of the sound head. Okay, very important. Okay, if you want to treat a bigger area, you have to do one of two things. You either have to use a different modality or you have to do more than one treatment. Okay, now it's important that if you're going to do more than one treatment, particularly when you're looking to mobilize an area, that you respect the stretching window. We'll talk about the stretching window later, but if you increase the temperature to where you want to stretch, mobilize the tissue, you want to make sure that you do it pretty quick. The stretching window is about 5 minutes, meaning that after 5 minutes, you start to lose the effect of the ultrasound. Okay, move the sound head less than twice the effective radiating area. So this basically looks at the speed of the sound head. So about 3 to 4 centimeters per second. So you're moving the sound head pretty slow. That's one of the more common errors that people have with ultrasound, is that they move the ultrasound head too fast. You're not allowing the energy to kind of get concentrated in the area and do what you need to do with it. Maintain good contact with the skin or the gel pad. So think of those things we talked about as far as energy transmission in the earlier chapters. So you want to make sure that you're maintaining good contact. You're not constantly lifting the sound head off of the patient. Every time you lift the sound head off of the patient or it comes out of contact with their body part region, you're losing that part of the treatment. And then again, any additional therapy, this is what I was getting at with the stretching window, any additional therapy, you want that to be done immediately following the treatment. So your stretching window is approximately 5 minutes. So you don't want to have them wait after you do your ultrasound to do your mobilizations or what have you after it. You want to have them you want to perform that immediately after you're done. Okay, non-thermal ultrasound and repair. So with pulsed ultrasound, again, they call it non-thermal. Technically, you will get a mild temperature increase because of the fact it's still ultrasound energy. You're just going to get less relative to what you would get. So essentially, the reason why they say it's non-thermal is because your goal of your treatment is not to use the heating effects of ultrasound, but what you're essentially trying to do is utilize the mechanical effects. So there are mechanical effects that do come out of applying sound energy to the body part that could enhance things, particularly through the repair process and even with inflammation. So they've used this in various ways, and that's where kind of some of the research has come from, to treat chronic ulcers, moderate osteoarthritis, and fractures. And probably more recently in the last few years, they've started to look at what's called low-intensity pulsed ultrasound and with fracture healing. So if you look on this picture here, this is a different type of ultrasound unit. It still uses sound energy, but it uses extremely low intensity, so lower intensity than even what you would get on the machines that we're going to utilize. And the theory is that this low-intensity pulsed ultrasound can help with fracture healing. So there's some additional research that still needs to be done on that. It's usually not I guess at this point, I don't think it's still yet a mainstream treatment, but it is something getting looked at in regards to fracture healing and ultrasound. So obviously, the heating effects we'll go over with ultrasound, but this is what I was getting at with the non-thermal. So again, if you want to utilize ultrasound for the mechanical effects only, you would select pulsed and then, again, select your other parameters based off that. So you would select a duty cycle that induces a pulse into the sound wave that would turn it off for part of the treatment. So what you would get is a lot of different chemical reactions and cellular activity. So increased histamine and serotonin. So again, those are chemicals involved in the inflammatory process. It'll help with macrophage activity, protein synthesis and tissue regeneration in kind of the repair process. So it's going to help increase fibroblast production, increase capillary density. So we know that as a part of the repair process, you get that angiogenesis, and it's the belief that ultrasound can kind of expedite that process. Improved wound healing, cell membrane alteration, vascular regeneration, and the fibroblast activity, which we just talked about. So again, histamine, if you think about all the connections between all of these things in the inflammatory process to the repair process, the belief is that the mechanical effects of pulsed ultrasound could enhance these processes as they're happening in the body, and kind of help expedite what's actually occurring through that process. So the mechanism of ultrasound. So there's two essential things that occur with ultrasound that create the energy, and some of this we see with so these are what we call the kind of the mechanical effects. You have what's called acoustical streaming, or some people refer to it as acoustic microstreaming. That's when sound waves basically exert mechanical pressure. So as those sound waves are moving through the body, we know our body consists of interstitial fluid. And what it does is it causes movement of the fluid, okay, going across the cell membrane. So as you see in the picture here, you have this movement of the fluid. That fluid is going to cross the cell membranes. That's going to create effects from the cell that we had talked about on the previous slide. And then you also get what's called the cavitation, or the formation of little gas-filled bubbles in the interstitial tissue. So what you get is the formation of these bubbles that are going to cause both expand. The bubbles will expand and contract over the acoustic cycles, and again, that's what's going to further create those mechanical effects that create kind of a favorable environment for, again, some of the normal cellular effects of healing. It should be noted that what we want to get with ultrasound is what is known as stable cavitation. So stable cavitation is when you get the rhythmic expansion, contraction. That's what you want to get. You can get what's called unstable cavitation, and that's when the gas bubbles collapse. That could actually lead to tissue damage. As long as you're following good ultrasound parameters and principles of application, that's usually not going to happen. Usually that's only going to happen with very low frequency, high intensity ultrasound, and you commonly wouldn't do that in a clinical setting based upon your treatment goals and what you're trying to accomplish. So your ultrasound contraindications. So ultrasound should not be applied near the abdomen if pregnant or possibly pregnant. Now, if you're sitting there saying, well, we utilize diagnostic ultrasound, but again, remember, diagnostic ultrasound has lower intensities. The intensities of therapeutic ultrasound are much higher. So we don't really know what the effects of that would be. So we wouldn't want to have, obviously, any negative effect with that. Over an infection site, joint replacement, heart, cardiac pacemaker, eyes, or genitalia. Precautions. So over an open epiphysis or a laminectomy site, you just want to kind of use precaution. I'd probably just limit the actual treatment area around these regions. So if someone did have a laminectomy done and you're doing a treatment near the spine, if you do have a younger athlete directly over an open epiphysis, you should not look to necessarily basically limit your contact with that area. And don't do it over large areas. Again, more so important than limiting it based on the effective radiating area. I think a better way to look at it is don't just keep the treatment below 2 times the size of the sound head. Phonophoresis is a way of utilizing ultrasound. The idea is to drive medication through the body. So this is where you will actually take a medication, and you have to use specifically prepared medications for this. So, way back when we thought that we could just take kind of over-the-counter hydrocortisone cream, because hydrocortisone is one of the medications that we'll use for phonophoresis, that we can just kind of take the hydrocortisone cream that you would use over, like skin rashes and stuff like that, and utilize that as an anti-inflammatory. The problem with it is that the contents of the over-the-counter hydrocortisone is too thick. It can't be driven through the skin. So you have to get specially prepared medications in order to do this. So the most common medications are both hydrocortisone and dexamethasone. Both of them are anti-inflammatory. The idea is that you would take the appropriately prepared forms of these, you would mix them with the conductive medium. Interestingly enough, there's little evidence to support the use of phonophoresis in clinical practice. There still needs to be more research on this. Part of the thing is that, what you're looking, one of the, kind of contradictions about ultrasound is that it's pro-inflammatory, and to try to drive an anti-inflammatory kind of seems to be counterproductive. So that's one of the theories behind it. But for phonophoresis, there's just not a lot of really good evidence. Plus, like I said, some of it is kind of, I guess, tricky, because you have to really make sure that you're utilizing the right parameters if you are going to utilize it. And we'll talk about, if you did want to experiment with some phonophoresis, some ATCs will still utilize it based on maybe experiences they've had with it in the past. We'll kind of talk about some of the treatment parameters if you were to use it that at least have been, most commonly deemed effective. So ultrasound for musculoskeletal conditions, so just kind of summarizing some of the information that your textbook talks about. They claim that when you look at the evidence, there's general lack of evidence. So there's certain conditions that ultrasound tends to be pretty good for. There's some support for use on calcific tendinitis or carpal tunnel syndrome. And getting back to the first statement where there's lack of evidence, it's not so much that there's evidence against using it, it's just there hasn't been a lot of evidence. There hasn't been as much research done on it, and that's where some of that comes in. It's not so much that the research has been done and it shows that it doesn't work. So some of the information that you have here, so for instance, there's some support for the use on calcific tendinitis or carpal tunnel syndrome. So the carpal tunnel syndrome, both of these were actually done with pulsed ultrasound at 20%. So if you look at the parameters in your textbook, you can see what they used for that. There has been some benefit when looking to improve range of motion. So when you're looking to use this in thermal fashion, where you're trying to get a significant temperature increase, there has been found to be some benefit with those types of protocols. So again, some of it is just one of the things, and I'll bring this up again with ultrasound later. Ultrasound, from a technique perspective, many times is kind of not done properly. So one of the things I really want you to take away from is, this is a modality that can be effective, but part of it is one, having your treatment parameters, two, your technique with the treatment being good so that the patient gets the most out of it. Okay, now as we said, we're going to look at both ultrasound and diathermy here. So diathermy uses electromagnetic waves. Okay, so essentially what they do with diathermy is they place the patient in an electrical field, and essentially here you're basically getting the same effects with diathermy as you would with ultrasound. So diathermy you can pick to do for a heating effect or for a mechanical effect. So you get similar cellular effects with diathermy as you would with ultrasound. There are two techniques that primarily get used. There's a capacitance technique and there's an inductance technique. We're going to talk about both of those. The inductance technique is the one that more commonly gets used. There are still some capacitance forms out there. So there's different types of diathermy out there. We're going to talk about both of these. The primary difference between the two is in the capacitance technique, the patient is placed more in the electric field, which capacitance diathermy does tend to heat subcutaneous fat a little bit more than the deeper tissue because of that. Whereas with the inductance technique, there's an electric current through a little coiled wire inside the applicator, and that has a greater tendency to heat muscle. So it kind of doesn't require the patient to kind of conduct the electrical field like the capacitance does, which the biggest drawback to the capacitance technique is that it could become uncomfortable. And again, it kind of tends to heat a little bit more superficially than the inductance does. And then there's also, when you're looking at this, most of the newer units are strictly just pulsed diathermy units. Now, this is kind of the unique thing from ultrasound. So with diathermy, there are units that are strictly pulsed. With pulsed diathermy, you will still get your tissue temperature increase. Now, if you want, you can also utilize pulsed diathermy for non-thermal purposes. But what you'll find with some units is some units are just strictly pulsed diathermy, and you can still get heating effects with that, unlike with ultrasound, you wouldn't utilize ultrasound in that fashion. Okay, so for diathermy, the reason why you probably don't see diathermy getting used a whole lot is the units can be expensive. Now, more and more over the past couple years, they've come out with some different ways to apply diathermy, so the cost has come down quite a bit, but that certainly has been one of the things. Basically, even in clinics, they tend not to have them because the cost of the unit, the amount of treatments you'd have to do to kind of recoup that cost, sometimes clinicians don't see the benefit of that. Contraindications and precautions: you'd want to make sure you remove all metal from the patient. You want to avoid the use near the abdomen, low back of a pregnant woman. And then some others you'd want to do. Now, obviously, for acute inflammation, we're only looking at the heating effects. We'll talk about for pulse diathermy, if you choose to use strictly mechanical effects, you wouldn't have to worry about acute inflammation because you'd be looking at that as part of the treatment. So just to kind of give you a visual, so this is the inductance technique with diathermy. So very commonly what you'll have is, and again, all units are a little different. Most units will have an applicator. They refer to this as a drum head with the coil inside. So what that does is it creates these currents inside the body, what are called eddy currents. And this is where the mechanical effects occur. Obviously, with a high enough intensity, you will get the development of heat. And basically, your heating effects at the different levels, as we described for ultrasound, is essentially what you'll be looking to do with diathermy. So what this does, again, the difference between this and the capacitance technique, and I'll show you some examples of the capacitance applicators, is that the capacitance technique utilizes the body part to conduct the electricity, whereas inductance just places the body part within the current. Okay, so it places the body within the current. It doesn't actually utilize the tissue to kind of drive the energy through the body, and that's why you get a little bit of a more comfortable, deeper heating effect with the inductance technique versus the capacitance technique. So these are examples of the capacitance technique. So this, you have two different examples here. This is what's using what are called airspace plates, and this is actually using a coiled technique. So you see here what's actually happening is these things are being placed directly on the body part. Again, these are both forms of capacitance. The difference between this and the inductance technique is that with capacitance, the body part is actually conducting the electrical energy that's going through. So what that means is you will commonly get a little bit more heating in the direct subcutaneous tissue. It's not that the deeper tissue isn't experiencing any of the heat. It's just that you tend to get a little bit more superficial heating occurring. And it could just potentially be, there's a greater chance of patient discomfort associated with the treatment. Usually, if you're going to see diathermy nowadays, it'll be the inductance technique. So you usually won't see these. However, you may come across them. And this is just basically what's showing. So the mechanical effects that occur here is you get a shift in what are called the dipoles. And this creates that mechanical effect to where if the intensity is high enough, you'll generate heat, or what you will just do is enhance the cellular processes that are going on with inflammation and healing. So you basically get this rotational pole movement that happens as the electromagnetic energy is passing through the body. Now, just to keep it simple, I'm just going to refer to diathermy again. Most of your newer diathermy units are strictly pulse diathermy. You will get some inductance machines that are continuous diathermy, but most of them are pulsed. And basically, again, I said the difference here is, unlike with pulsed ultrasound, where you're not looking to get a thermal effect, you will look to get one here. So if you do want a non-thermal treatment, what you will do is you will set a very low frequency and what's called a short phase duration. So in other words, the phase duration kind of looks at how wide or narrow the individual waves are. So what you'll look to do there is you will do a low frequency short duration treatment. That will be for your non-thermal. If you are looking to get a 1 degree increase, okay, so if you do want to get a 1 degree increase, you want to basically do what you would do during the subacute inflammatory phase. You will increase the frequency. You'll go somewhere between 400 to 800 pulses per second, and your phase duration will be between 100 and 200 microseconds. That's what that, the little U with the kind of tail on the front, that refers to microseconds. So again, subacute inflammation, 400 to 800 pulses per second, 100 to 200 microseconds for the phase duration. If you want it to have just pain reduction, reduction in muscle spasm and chronic inflammation, again, 400 to 800 pulses per second and 200 to 400 microseconds. And if you're looking for vigorous heating, so your 4 degree increase, you're going to want to do at least 400 microseconds and 800 pulses per second for stretching and mobilization. So you essentially have those 3 different levels, or essentially 4 different levels if you're counting the non-thermal. You have those same levels with pulse diathermy as you would with ultrasound. So the 1 degree increase for the subacute inflammation, the 2 to 3 degrees for the chronic inflammation, muscle spasm, pain reduction, and then the 4 degree increase for the stretching. And again, just some of the different names utilized for this, just so that you see pulsed electromagnetic field or pulse radio frequency energy. It's just kind of other terminology utilized to describe this. Again, talking about the different uses. It has been used in the treatment of non-union fractures and osteoarthritis and wound healing. And again, as I said, some units are only pulsed units, and that's kind of where some of the confusion might possibly come into play with this, is that with diathermy, you have pulse diathermy, and that can be utilized to create a thermal effect. So both pulsed and continuous diathermy get utilized for a thermal effect, whereas with ultrasound, you're only using continuous to get a thermal effect. And again, some units are only pulsed units. You typically see that with the newer units. So then in the next part of the video, we're going to go a little deeper into the clinical application of these modalities.